Assalamu alaikum, welcome back to my channel and welcome in the next video. Welcome to the next video. So today's video is about safety and infection control. Those that are new in my video, it is so I will just explain that we are preparing Nclex RN exam preparation by with simple words and by sounders. So here I am going to describe about safety and infection control category. The question is, the nurse prepares to care for a client on contact precautions who has a hospital acquired infection caused by methicillin resistant staphylococcus aureus. We call MRSA. We rarely name this, we always say MRSA patient. So the client has an abdominal wound that requires irrigation, that has a tracheostomy attached to a mechanical ventilator which requires frequent suctioning. The nurse would assemble which necessary protective item before entering the client's room. So just I will explain a little bit about the patient, about this criteria, about the question. So when you are dealing in Nclex exam, just make an imaginary word in your mind. Just memorize all the hospital settings. You are in hospital and this is a safety and infection control category. So you are preparing a patient, that you have to deal a patient who is MRSA positive in your hospital, and what kind of protective equipment items you use when you go for MRSA patients. So here it is gloves and gown, and you are going, just remember this, that patient has abdominal wound that require irrigation and has a tracheostomy attached to a mechanical ventilator. So remember here, when they have irrigation, it can be splashed the water as well. So number 1 is gloves and gown, number 2 is gloves and face shield, number 3 gloves, gown and face shield, number 4 gloves, gown and shoe protectors. So here is the answer, it's already mentioned here, answer number 3, gloves, gown and face shield. So the rationale, it is very important to read the rationale. Let's go for rationale. The rationale is, this question addresses the subcategory safety and infection control in the client needs category. Safe and effective care environment, it addresses content related to protecting oneself from contracting an infection and requires that you consider the methods of possible transmission of infection based on the client's condition. Note the data in the question, because you have to read the question, note the data of the question, and here why it's the answer 3 is good. Note the data in the question because of the potential for splashes of infective material occurring during the wound irrigation or suctioning of the tracheostomy. Option 3 is correct. So you should have gloves, gown and face shield, because you are going to irrigate and you are going to suction, so might be you could have some splashes on your face. So that's why it is important to this kind of protective items. Hopefully this will be good for you, this will be helpful. This is a small video for you guys, for Nclex RN students. Hopefully this will be helpful, and I would really appreciate, guys, again you could subscribe my channel, like and share. Bye for now, hope to see you in the next video.